Over the years, I've got a special interest developed around ADHD presentations in females. And I've presented both at the Neurodiversity Weeks or at ADHD seminars around females. What I've seen is that the gender proportion, if you think around compared to childhood versus adults, it changes. And it's interesting that in the UK, we have a generally agreed gender proportion ratio of 5:1, so 5 boys to 1 girl when we think around childhood ADHD. Interestingly, when we look at an adult gender proportion ratio for adult ADHD, yes, ADHD in adults, it's still a bit more commoner in men, but the gap is much more narrower. So from a 5:1 ratio, we now go on to a worldwide prevalence gender ratio of adult ADHD as 1.6 men to 1 females. And the question, I think, so as a clinician, or perhaps as somebody who is watching this video as a patient, or as a relative of somebody who they suspect of having ADHD, what's happened to all those girls who were never diagnosed as when they were in their school life or as a child? Comparing my clinical practice with evidence, it's interesting that the NICE guidelines in the UK actually now recognize that ADHD is under-recognized in both girls and women. The rates of assessment, the rates of referral to specialist ADHD services are much lower than in men. And the rates of being misdiagnosed with another psychiatric condition, for example, like depression or anxiety, are higher in females as compared to men. Which leads on to the question of what are the reasons around it? What are the diagnostic challenges which perhaps clinicians may face, or perhaps what parents and teachers may face in not recognizing ADHD at an earlier stage? And what research evidence has shown, which is actually also seen in my clinical practice, is that ADHD, although the diagnostic criteria and the symptoms of inattention, hyperactivity, and impulsivity are exactly the same irrespective of the gender, the role of an ADHD clinician then becomes is how are these symptoms presenting in a particular individual? So what we've seen from studies is that a lot of times ADHD in men, for example, or in boys, is more of a behavioral thing, how their presentation is affecting others and hence might be easier to pick up. In girls, we are aware that the inattentive type is perhaps more commoner than men. And when that happens, if somebody has got a reasonable level of intelligence or a higher level of IQ or a very good support system at home or in school, they're generally managing. And what I've observed in my patients is they describe around that as adolescents or when they were in school life, there was a lot of issues around it. Why am I not being good enough? Or I may forget to do my homework, or I may forget to revise for my exams. There was a lot of self-criticism, there was a lot of self-blame, and the self-worth tied to academic achievements resulted in them perhaps being very obsessive around schedules, perhaps very rigid in terms of lists or managing their homework commitments. And that leads on to us thinking around that maybe we need to review ADHD in females as more of a lifestyle management disorder where although the symptoms itself remain the same, their presentation or how they affect the individual changes according to various life stages. So thinking around from primary to secondary school, and then moving on to university life where due to the external scaffolding systems of parental support and the school support being slightly disappearing in university life, the first signs of impairment start appearing. Were they struggling in lectures? Were there problems with attention in this particular girl? Were there issues around that she chose to actually study at her own? Or last-minute studying and last-minute completion of assignments at a cost of great personal stress? They somehow manage and end up in a very good professional job, but perhaps they had the opportunity to delegate certain administrative tasks to other individuals. They had support of a secretary, or perhaps they were in a role where their impairments were frequently more covered up because they were either coming in early to work, or perhaps staying in late. And thinking around it, one could question, were they actually coming in early or staying up late to manage their workload when the distractions of an office environment were not there? So what were the compensatory mechanisms which this individual has put in their lives in order to perhaps mask some of these symptoms of having attention dysregulation, poor time management, poor organizational abilities? As soon as responsibilities increase with increasing demands on their personal lives, maybe they've entered into a relationship or parenthood. So think of it as the more balls you have to juggle in the air, at some point in the life, things start falling apart. And that leads on to that a lot of times in my clinic, most patients who have suspicion of that they have ADHD usually tend to present around the 30s or 40s, which ties in with the new evidence around hormonal changes in females, particularly around estrogen, may lead to a greater problems in terms of the impairment of the executive functioning of organization and ability to manage with various administrative tasks. One of the key features which I would like to stress is that ADHD, the diagnostic criteria remains the same irrespective of the gender. The question then becomes is, as an ADHD specialist, how do I identify that this impairment is still present, but it's not being evident due to the various compensatory mechanisms or perhaps certain strategies this individual employs at a great level of stress and personal cost to them. We do know that the diagnosis of affective disorders like depression and anxiety is much more commoner in females as a struggle of managing life with the impairments of ADHD. So if you do suspect that you've had problems with time management, organizational challenges, issues around feeling restless, missing appointments, feeling that it's just a bit too much sometimes and you can't manage different demands on your attention span, just a thought around, could this actually be undiagnosed ADHD? And hence I would suggest using one of the screening instruments for ADHD on our website and considering booking an appointment.